In outreach planning, there are proven participatory tools that are used by the community to peer educators to create ownership among them. The tools broadly help improve quality of outreach, service level, and build peer educator capacity to monitor their own performance and also continuously improve programming.
NACP 3 aims for saturated coverage among the core population, and it also aims to meet people, bring under the regular contact, which means at least 15 days once, so that they can get all the services from the project. Outreach is one of the critical component which bridges between the services and the community. The outreach should be planned peer-led, which means the true peer educators who are representing from their own community should take a lead in the peer-led outreach. The detail of how to plan a peer-led outreach, how to roll out the services, all explained in the operational guideline in detail.
Peer-led outreach is considered to be one of the most effective and sustainable tools for bringing in new community norm. This approach helps build trust and establishes credibility with the vulnerable groups, as they are more likely to respond to people who are from their own community. It also enables the project to reach a large number of people effectively and be a bridge between the service and the community. Peer educators play an important role in project implementation, as they provide a vital link between project staff and the community. Let us hear from two different peer educators about peer educator and peer-led outreach.
I am a sex worker working in a home-based setting. I am a peer educator. I was selected by my group members as they all feel good about me, listen to me. I educate them on the use of condoms and thereby prevention of HIV/AIDS.
I am working as a peer educator. For me, my community is important. I belong to the community first. I am working for them. It is my job to find out ways to educate the community, solve their problems, and persuade them to avail of the facilities. I not only know the community members but the other people in the environment. That is why I was chosen as a peer educator.
It is very important to understand the peer selection criteria and process. Step 4 in the TI guidelines details these aspects. Now let us understand outreach planning. Outreach has to be a planned activity. The planning is done by peers with help and support from outreach workers as well as other critical staff of the project. Planned outreach produces better efficiency as well as output. One of the critical tools used to plan outreach is contact mapping.
Since you have problems to reach your contacts, we will try to solve it through contact mapping.
Contact mapping helps community map their contacts with other sex workers. A master trainer trains the peer educators to use contact mapping as a tool. With the help of this tool, they are able to systematize their contacts so that there is no duplication. Peer educators are then able to approach those sex workers with whom they have a personal rapport and tell them about HIV and clinical services they could avail of.
Now we have finished mapping. We have found out where the duplication is and in which spot. Now we have to find out in whose list the duplication lies.
Here, the master trainer is training peer educators to understand where the duplication occurred and to whom.
We have made a list of names of the community members known to each of you. We see that Shantama is in Geeta's list and in Nagu's list also. So there is the duplication.
A list of names known to each peer educator is drawn up, and each peer educator decides whom she has a good relationship with and would be able to convince her to come to the clinic and avail facilities.
I don't live near her house, but she will listen to me as I know her very well.
To sum up, contact mapping helps participants understand who the contacts are after mapping them in each spot. Participants, through group work, list the contacts. Participants are asked to select spots in the map. The group has to list names of the contacts. This tool helps to avoid duplication of contacts. For further details, please refer to Annexure 5 in the TI guideline.
We will now discuss opportunity gaps. This is an important tool in outreach.
ಈ ಅವಕಾಶದ ಅಂತರ ನೋಡೋದಂದ್ರೆ
As in this chart, opportunity gap means out of 743, we have met 500. So, we have a difference of 243. By this method, we realize that 243 community members are not getting benefits in the taluk.
Opportunity gaps are obstacles that impede an individual or community from moving from one level to the next level. The project should work on removing obstacles and creating an environment so that the movement from one level to the next becomes easy. The cause of opportunity gaps may vary from individual to individual. The project should develop systems to assess opportunity gaps at every level by using qualitative or quantitative information. Necessary steps should be taken to minimize the gaps and maximize opportunities at every level.
While planning outreach is crucial, it has to be understood that outreach cannot be completed with planning alone. It has to be implemented as well as monitored by the peer educators themselves and other non-community staff.
Peer educators meet with their contacts, gain their confidence, and are able to convince their community members on the importance of health education and the risks they face by not using condoms. They are able to persuade them to avail of the services and get proper treatment.
Let us now hear from an organization how peer educators are appraised in their project.
In the Outreach Management Committee, 6 of us are from the community, 4 are staff members. Outreach Management Committee looks into peer appraisal. The appraisal is based on the feedback about the work of the peer educator, their conduct, attitude, and their ability to respond to community needs. This information is recorded in the monitoring sheet and graded. Based on the performance, the peer educator gets promoted.
To sum up, outreach needs to be a peer-led and a planned activity throughout the life of the project. Peer-to-peer communication has to be dialogue-based. There are other tools for outreach planning, implementation, and monitoring cited in the TI guideline. Please refer to page 75 and Annexure 5.